Now, the impact on mental health is no surprise, but the gap between the haves and have-not has never been so stark.
Absolutely. And I think that unless we do something to try and address this now, it's going to only increase even further. We've seen since the start of the pandemic, it's been highly publicised, the growth of the wealth of the billionaires. We're creating richer and richer people, whilst we can see the results of the study released today, that people who are struggling are finding it ever more difficult.
And those people who are struggling, those from minority backgrounds, among the hardest hit too. Why do you think that is?
Just because they've always been struggling, and what the pandemic has done, it has highlighted just how much these disparities in social inequalities exist. And people who were living just about making their ends meet by working across different jobs have now really struggled and have had to be forced to go into either losing lots of income or having to go onto universal credit, which in itself isn't an easy process for anyone to try and gain.
And surely the idea of state support is that the most vulnerable, those newly on benefits, are given support.
It is, but it's not an easy system to access. There are lots of hoops. And if you think about the pandemic and how much strain it has put on individuals to try and navigate something new, the benefit system, if you have never applied for a benefit, there are so many pieces of documentation that need to be shown. There are so many bits of information that have to be shared before you can even qualify. You need to show all of your existing savings, your income, and you need to be out of work for a long period of time before you even qualify to go on to benefits. So there is a gap that people can very easily fall into.
Do we need a joined-up system linking benefits with mental health support?
Absolutely. I mean, there is a huge correlation between being on very low incomes, being on welfare systems, and mental health issues as well. So we need to be able to support people. And if you are feeling really anxious, if you're feeling stressed, and if you've got depression and any range of mental illnesses, the last thing we feel capable of doing is filling in these really unwieldy forms.
And these cases of suicide among those who say they're excluded from COVID financial backing, also very troubling.
Really tragic to hear, and it's one of those things. We have such high levels of suicide in this country already, and to know that there's something that potentially could be preventable if people had the support that they needed, if there was financial support there for people to access, then that might have been the step that would have prevented that. And that's just such a tragedy for us as a society to have to bear.
So getting access to the support, should that obviously be made easier? And also in terms of more money, can the government help by investing more in this?
Yeah, I mean, I'm very grateful that the government are investing in mental health services, but it's worth noting how much they've already stripped from mental health services over the last 10 years or so. And so actually we're not getting anywhere near a decent mental health service provision for people in need. We've got a really disjointed system. If you think of something like eating disorders, you have to be at a very low BMI before you can access those. So it's almost a position where you have to be very ill before you can access it.